Hi everyone, welcome to our video of the week. Dr. Peter and I, we want to continue to give you some information that will help you with your health moving forward. And what we know is that a lot of patients come here because they got lower back pain. A lot of patients come here because they have pain in their neck or tension in their neck. And what Dr. Peter and I want to do in this short video is we just want to demonstrate for you some of the easiest, simplest stretches that you can utilize that will reduce tension in your neck and your shoulders. And we're going to actually show you two different ways to do it, because there's a way that you can do it from a standing position as well. Some of you folks spend a lot of time seated. Maybe you've got an office job or you're spending a lot of time at a computer. So we're going to show you how to do the same stretches from a seating position as well. So what I'm going to get you to do is, what we're going to start with is I'm going to have Dr. Peter demonstrate a couple of really good stretches for the neck area from a standing position.
All right, so I'm going to show you a couple of stretches here. The first one's going to be for the middle of your neck, a lot of the scalene muscles in here in your traps, okay? So all you're going to do is you're going to bring your head down to the side, right, while looking straight ahead. You don't want to turn your chin in. You want to look straight ahead and come down. And you can actually get the stretch a little further by, if you grab the back of your arm here, the same side you're stretching, and pull it down. As you can see over here, I'm pulling this down here. So you're going to come across here and pull across, and it's going to increase that stretch all along my left side over here.
Just
right?
turn around one more time again, Dr.
Sure.
Peter. So again, which way are you tipping here?
So I'm stretching this side of my neck, so I'm actually pulling on this arm to bring my shoulder down.
So we're keeping that shoulder down, because a lot of the muscles that we're stretching out, they start in the shoulder and they come up into the neck. So by keeping that shoulder down, you're really going to accentuate that stretch.
Exactly. When I was doing the opposite side, I just grab the other arm and pull that down and come across the other way, as you can see here.
Beautiful. And what he's doing is, you don't want to tilt your body, tip your body, keep your body straight, but just pull that shoulder down, and it should just be the head that's moving.
Perfect. And the next one I'm going to teach you how to stretch is a very, it's a muscle that's commonly really tight in a lot of my patients here, okay? It's called the levator scap. It runs from your shoulder blade over here up to the side of your neck, right? So in this one here, what you're going to do is you're actually going to bring your head down and across. You're trying to touch your nose to your armpit like this as you come down like this. You can pull on your head to get a bit more of a stretch, or you can have your hand down, right? And then the same thing with the other side. Across like that, and you can pull down a bit, and it's going to stretch all along here.
So the difference would be, in the first stretch that Dr. Peter was showing, it's a straight lateral stretch. This one's a little bit more of a 45-degree angle.
Exactly.
Right?
Exactly.
And you're going to feel the pull. Instead of feeling it pull on the top of the shoulder, the pull's going to come a little bit more back into the shoulder blade that Dr. Peter was showing.
Exactly.
Make sense?
Yeah, exactly. Exactly.
So the other thing we wanted to demonstrate was, you can actually, if you're spending time in a chair, you can do these from a seated position as well. And the same stretch can be accomplished. Instead of reaching behind and holding your wrist down, you can actually use that hand and grab onto the bottom of your chair, or you can even tuck that hand underneath your bottom to trap it, to keep that shoulder down. And you can do the exact same motions that Dr. Peter was just demonstrating, where you're pulling the head straight lateral. Dr. Peter, how long do you recommend a patient hold a stretch?
I recommend at least 30 seconds up to a minute.
Very good, very good. And what you should feel is, as you do that stretch, it should, the tension that you're feeling should start to subside. And if it does, you can even gently press a little further. If the pain gets worse as you're doing it, then I would recommend that you discontinue it until you've had a chance to talk to Dr. Peter or myself. So you'll notice that I'm sitting on that hand, pulling the head to the side, and then you can do the same thing that Dr. Peter was just demonstrating, where you're turning the head and you're kind of tucking the chin down and across to the opposite side as well. And again, you're going to feel a nice stretch in the shoulder blade, and into the side and the back of the neck. Do you have any other points that you wanted to bring up about that, Dr. Peter?
No, I believe you covered everything.
Yeah, so those are simple things that you can do at home that will help you get the most out of your care. Obviously, Dr. Peter and I, we're working on your posture and your alignment, but part of that has to do with getting mobility there, getting things moving better. And if you're doing these kinds of stretches regularly and working on your flexibility and range of motion, it's going to allow you to hold your adjustment longer and get results sooner. So I hope you found these stretches useful and helpful. And if you have any questions at all about them, please don't hesitate to talk to Dr. Peter or myself. We'd love to help you out. You have an awesome week. We look forward to seeing you soon.